State your name and your job.
Hunter St.laurent, and I'm a registered nurse at MUSC.
Specifically, do you do as a nurse?
My day-to-day consists of passing medication. If a patient calls out and needs to use the restroom or needs to be cleaned up, we'll do that. Getting the patient any drinks or food that they need. Just monitoring their overall care all day. We take their vital signs. If there's any acute changes, we page the doctor, let them know, get them to bedside to kind of assess the situation.
How long have you been doing this?
I reached a year as a nurse in February of 2020.
Since this global pandemic has broken out, has this affected you, or will it affect you?
Yes, it 100% has affected all of us in the hospital. So right now we're trying to prepare for how New York is and the bed overload. So right now they canceled all elective surgery as of 2 weeks ago, which I'm on a surgical step-down floor. So our patient load has been cut, so we keep getting canceled. So we're having to use our own personal PTO or paid time off due to only we have 23 beds. Normally we have 23 patients. We're pretty much always full. And we normally also can take a hallway patient. Lately we've only had 5 to 6 patients. They're just trying to keep our numbers low for right now because they're predicting that in about a week and a half we're going to fill up and have to have hallway patients because it's slowly moving down here, and they just don't want to be in the trouble that New York was, where they had full hospitals on top of taking corona patients. As of right now, it stinks for us because we're having to use PTO and get canceled and kind of play it day by day whether we're going to get called in or not.
What do you fear most of being a nurse?
Just watching the news and kind of seeing everything. I fear most, 1, contracting the virus, 2, infecting people that I come in contact with. That really makes me nervous because you don't show signs for typically 2 to 14 days. So you can definitely infect either other patients or maybe somebody that you come in contact with, whether you're grocery shopping, things like that. I'm also nervous about running out of supplies. They say that that's definitely a huge issue in New York right now. We're taking steps now to prevent that from happening, but definitely just being in the front line of everything happening is definitely very scary to think of. I have not seen anyone positive. None of my patients have tested positive. I had 2 COVID, what we're calling rule out patients. So patients that come in with the signs and symptoms, a fever, a cough, shortness of breath. We do the test. I had to run 2 of the tests the other day. They now have a test at MUSC that takes about 4 to 12 hours to get results, which is incredible compared to what it was. And both of my patients tested negative. At first, they were saying absolutely do not reuse any of our PPE, the personal protective equipment. They were saying don't use anything twice, put everything in these bins that they put by the door. And then about a week ago, they were saying put all masks and eyewear in paper bags next to the room when you come out, and you have to reuse them all day. So when I had the 2 rule outs, I had to reuse my mask and goggles the whole day. Well, now they're coming back and saying that that just isn't safe at all and that we need to not reuse anything. So it's changing, and you just have to make sure that you're staying on top of your emails, which is kind of frustrating, but I understand that they just don't really know enough about this virus yet to really say what's safe and what isn't.